Here at St. Joe's CHF Clinic, when we get a new patient, and then of course with each visit, the patient comes in, we get their weight, we will do a full head-to-toe assessment. We also check if they have any swelling or lower extremity edema. We always ask how their diet is. We do check labs for patients, and if their weight is up, we will give them an IV diuretic. The whole goal of patients coming here is to keep them from coming back into the hospital and having repeat admissions. The foundation plays an important role for the overall CHF and cardiac rehab, pulmonary rehab. I do have a lot of patients that their ejection fraction is high enough where insurances do not cover them to participate in our exercise programs. And exercise and cardiac rehab plays just as important role as them coming into the clinic. I would probably say more than half of our patients are affected by that.
After 3 bypasses, I wanted to get back to a normal life, and hopefully, that's where I'm heading to. Cardiac rehab is basically 36 sessions, and it's 3 days a week. I would recommend anybody that's had, heart issues, I would recommend coming for the rehab.
Typically, patients come here to cardiac rehab post some sort of surgery or heart attack event, or if they've had a stent placement. Doctors want them to come in to exercise so that they can strengthen their heart. They do wear the telemetry monitors the whole time that they're exercising. We get their blood pressures before they start to exercise, somewhere in the middle of when they exercise, and then at the very end. Most people do have at least some sort of insurance. But unless they have some sort of supplement with the Medicare, then there typically is a copay that goes along with it. We do lose some patients because of that. They want to come, but they're faced with a $25, sometimes even $45 per session copay, which is really out of reach for a lot of people. The foundation has given us grant money for when patients come into what's called a maintenance program. They stay on with us. They like the fact that we keep an eye on them and still monitoring their blood pressures. We're very appreciative. The foundation has been very generous over the years. A lot of the equipment we have is a result from the foundation. Our telemetry system is a result of the foundation.
I've been coming here for almost 19 years. I had a heart attack in July of 2002. I have a damaged left ventricle. I messed around for months, and where I was going to church, the priest had also had a heart attack and was coming to cardiac rehab. He's the one that got me here. I like coming here because of the camaraderie. I feel very comfortable being here. I wouldn't want to be in another facility. I probably would not do it if it wasn't for coming here. Very appreciative of the donors who provide the equipment for here, because we need this. So many people need it.
Patients at the CHF clinic are referred by a physician. Usually when we get the referral, the patients are seen within a week. And then after that, they're seen according to their needs. We tell them if they gain weight, usually like 3 pounds overnight or 5 pounds in a week, they need to call us, and we do same-day appointments.
We give the scales to patients when we're assessing them and making sure that they're weighing every day. Some of our patients don't have the funds or the means to be able to buy their own scale. The ultimate goal is to keep them feeling good, to keep them out of the hospital. Sometimes their ejection fraction, their heart muscle can actually get stronger, and does get stronger with medications and dietary compliance.
The reason I come here because of Dr. Rehisha. She's the one that found that I have too much water around my heart. The shot helped me release all the water in my system. It's helped me tremendously. I have more energy and I can do a little more. I like the service, it's excellent. Nurses are wonderful. And I don't have to, be involved going in and out of the hospital. I'm very happy. I feel good. That's all I'm asking for.
I work with patients in the hospital immediately after they've had open heart surgery and help them get strong in the hospital so they can go home quicker. We also work in the outpatient section here. We help to continue getting them better through exercise. This is a safe environment for them to be in. We get their blood pressures continuously. We have education with them. They can meet with a dietitian. Most insurances will cover 3 times a week for about 3 months. After the insurance coverage is over, The patients can come in as a monthly payment. If somebody is not able to afford the $45 a month fee, the foundation picks up the payment for them.
I have been going to a gym for a number of years, and everything was fine until May of 2020. I had a heart attack. As much as I love my trainer and love what he was doing, I felt that this was the right place for me. These young ladies are angels. They are heroes. And I know we hear that term quite a bit, especially during the pandemic. But as someone who is living with it and living through it, they are. You are saving lives. If it is important that your donation helps to save lives, this is the place.